The theme of World Health Day this year is From Farm to Plate, Make Food Safe. And by a happy coincidence, the theme of World Consumer Day, which was observed on 15th of March, was promoting consumer access to healthy food. At the same time, it is not so much of a coincidence. If you think of the UN guidelines for consumer protection, which date back to 1985 and are currently under review, which urge that priority be given in all countries to areas of essential concern for the health of the consumer. There is specific reference in those guidelines to quality control, distribution facilities, standardized labeling, information, education, research. In the specific context of food, the guidelines urge that we must take into account the need of all consumers for food security and to maintain safety criteria and dietary requirements. Sustainable agricultural policies, conservation of biodiversity, protection of soil and water, the quality of drinking water, all priority areas within the UN's consumer protection guidelines. Specifically in the area of pharmaceuticals, countries have been urged to maintain adequate standards and appropriate regulatory systems for ensuring quality of use. Appropriate measures are also encouraged in the areas of use of pesticides and chemicals, especially when used in the production and storage of food products. In the proposed amendments to these guidelines, there is a reference to the threat to consumer safety, which may arise from the use of substandard, falsely labeled, falsified or counterfeit products. It is clear, therefore, that the protection that we need to afford to all persons from hazards to their health and safety have always been regarded as a fundamental objective of consumer protection. And this coincidence of purpose should encourage us at the national level to learn to work together and to harmonize our objectives and to harmonize our working methods. And this particular occasion, when, as an earlier speaker observed, representatives of 4 distinct departments are present, is a particularly happy augury. This audience does not need reminding of the threats posed by the 4 predominant risk factors of tobacco use, the abusive use of alcohol, poor diet, and the lack of exercise, leading to the possibilities of heart disease, diabetes, cancer, and hypertension. We are fortunate, despite some hiccups, in having strong anti-tobacco legislation in India. But much more needs to be done in educating the general public on the other risk factors. We need a systematic, well-articulated, and well-focused campaign, possibly piloted by both the Departments of Health and the Department of Consumer Affairs, to promote safe and healthy diets, reduced salt intake, the need to go back to traditional foods where appropriate, and the need to promote the cultivation of fruits and vegetables without the excessive and deleterious use of pesticides. This will not be an easy job and will require substantial resources, but we cannot easily secure any lasting impact on the health of our people without a well-resourced campaign in public education. Coordination with other departments, both of the Government of India and the state governments, will also be needed. If one considers, for example, a very large number of public institutions run by the Departments of Education around the country where meals are served, the midday meal program which covers the entire country, for instance, the various residential schools run by the Department of School Education and Literacy. Clearly, these are areas where immediate focus needs to be given on what is being served to huge numbers of children and to ensure that these meet a certain safety and health standard. A related aspect is that of packaging and the information provided to consumers on the contents, including calorific value, carbohydrate content, etc., of packaged foods. My department, Department of Consumer Affairs, also operates the legal metrology rules which govern these issues. And in this context, I would like to place on record the extremely important work done by the Food Safety and Standards Authority of India in the matter of developing food standards and pursuing their implementation. The CEO has just told us that FSSAI has, for practical purposes, been in operation for slightly under 5 years, and I think we must recognize the enormous work that has been done in these 5 years. It is no secret that just as any move to control the the manufacture and sale of tobacco products is opposed by the industry, the work at FSSAI is opposed also by some sections of industry. We must recognize that these objections are misplaced. Food standards in India must meet with world standards. It cannot be argued, as is unfortunately often the case, that food items be sold in India which do not meet standards set in the countries of their origin. It cannot equally be argued that we do not need food standards in India and that in a poor country people will eat anything. India must have a strong and robust regime in the regulation of food standards, and every encouragement needs to be given to FSSAI that they pursue this goal. In due course, but not in the very long term, we must also work towards ensuring that all grains, pulses, cereals, etc., including those within the public distribution system, are sold in appropriate packaging with relevant details published for the benefit of the consumer. A much more difficult issue is non-packaged food items, most importantly fruits and vegetables. At the high end of the market, we find what are called organic fruits and vegetables, and it is still somewhat unclear how exactly these are being certified as organic. There are several standard-setting bodies with their separate logos and certifications, though the Bureau of Indian Standards under the Department of Consumer Affairs has not systematically addressed this issue. There is also a small and somewhat forgotten program under the Ministry of Environment and Forests for the award of an eco mark, which again is known only for its absence in general use. At the lower end of the market, in the large vegetable mandis and smaller neighboring markets, there is no way of ascertaining any detail regarding the fruits and vegetables on sale. Now, we have heard from our colleagues from the Department of Agriculture and Cooperation a very clear and comprehensive statement on what the issues are when we talk about pesticide control and the necessity of having to balance the possibility of enormous crop loss in storage and warehousing with the counterbalance with the possible harmful effects of excessive use of pesticides. Now, clearly, this is an issue that needs to be resolved. We have, as I said, the well-stated agricultural position. We also have the results of surveys, etc., conducted from time to time by usually non-governmental bodies, which have found unacceptable levels of pesticides in foods of mass consumption. So clearly, this is a problem that is not going to go away unless we have a very well evidenced and well-stated position of what our likely outputs should be and how we are going to work towards them. Several of the earlier speakers have spoken on the importance of street foods in India. And some of you may even have seen the piece in today's Hindu by the RD of Zero, where this issue has been raised. And it's important to remember that we are not simply talking about outlets where middle-class citizens in the big towns occasionally go for a snack. We are talking about our food outlets, and there are approximately 30 lakh street food vendors in the country, which are the only source of food for very large numbers of migrants, pavement dwellers, daily wage laborers, and other homeless persons. So it is actually a very, very important issue. The Bureau of Indian Standards has developed a few limited standards for the preparation of street foods. But the implementation of these rests entirely, these are voluntary standards, and the implementation rests entirely on how effective the food inspectors and people like this in the states are. Again, as in the case of pesticides and as in the case of food standards, there is a case for great coordination. The Ministry of Housing and Urban Poverty Alleviation some years ago passed legislation on street vendors. That legislation calls for registration of street vendors. It's probably a good place to start to see how many people have been registered as vendors of food items. And at least it's a start to get a better sense. The figure of 30 lakhs which I mentioned is still not particularly well based on, and I haven't found too much evidence for that. Everyone says 30 lakhs, but no one seems to know where this figure has come from. So it's probably worth doing. There is one last thought I would like to leave with this audience, and WR has mentioned this in her address, and which is the question of nutrition. The subject of nutrition is one that has never been satisfactorily recognized as a policy responsibility of any one line department or ministry in the government of India. And this is a very, very urgent requirement in the light of India's malnutrition crisis. The Hunger and Malnutrition Report, popularly known as Hangama, released by the Prime Minister in January 2012, showed that 42% of children in 112 rural districts of India were malnourished, with stunting at 59%. In the entire country, 48% of children under 5, or 61 million children in all, were stunted due to chronic nutrition deprivation. Clearly, we need to look at a range of short and long-term measures to tackle the situation, but availability and access to balanced diet, both for the pregnant or lactating mother and for her child, is clearly one of the most important. This is not to deny the need for access to quality health care at the primary level, but very clearly focus of the pregnant mother, the pregnant woman, the new mother, the infant child, very clearly need to be the focus of whatever nutrition program is taken up by whichever department. This is not a time to quibble about whose responsibility this is when the problem is so clearly stated before us. And none of these problems is likely to go away very quickly. But an occasion such as World Health Day gives us the opportunity to reflect on the responsibilities that lie before us in whichever area of government we work, to promote public welfare and to recognize the right of all citizens to aspire to a better and more healthy future.